Dizziness, headaches, migraines, pening kepala. We've all complained about it before. At some point, we have. I have. Actually, just yesterday, I was lying down because of a headache. It was real and it was not comfortable. But even if we're all experiencing these dizzy spells, it can be tough to put into words how you're actually feeling. And now that we know that there are many different types of vertigo, the task of describing how we feel, it becomes even more critical, especially when you want to go and receive treatment, right? So to give you an idea of what I'm talking about, I'd love to play some stories from real life vertigo patients.
Aiyo, vertigo ah. I did not even know what that word meant before seeing the doctor. For years, I suffered from dizziness, and I tell you, it was so thorough. Every time I moved my head, lie down, stand up, that's it lah, gone. I had no idea what was happening, so I tried to search for some home remedies, but that did not help much. It was so hard to live that way. My life was completely turned upside down. I was so fed up. And finally, I decided to go to the doctor. And she told me I actually had something called BPPV. They ended up giving me medication and did some gentle head maneuvers. Wow, I tell you, I never felt better than after seeing a doctor.
There was this one time, for some unexplained reason, I kept seeing the room spinning around me. I also kept having this buzzing, ringing sound in my right ear for such a long time. Eventually, I had a really bad fall after standing up. I face planted right onto the marble floor. My forehead was so swelling for so many days. Finally, I went to see the doctor to treat the swelling, but I ended up learning that I had something called the Meniere's disease. Turns out fluid accumulation can also affect the ear balancing mechanism. Thanks to my doctor's advice and care, I now know that there are easy lifestyle changes and taking the right kind of medication that could help me feel so much better.
I felt like I was constantly on a rocking boat. My balance and coordination were quite poor. My friends used to mock me, like they'd say, "Shut up, mapo ah." For the longest time, I thought I had some form of vertigo from my recent visit to the clinic. But to my surprise, upon further assessment, I actually showed signs of brainstem-related problems. I didn't think that was possible. Fortunately, I decided to consult my doctor rather than assume it was something normal, and now we are discussing management options.
My name's Afik Kamarudin, and together on the Vital Sign podcast, we'll be tackling some of life's most overlooked bodily mysteries. Now, we just heard from a couple of patients who have successfully managed their vertigo with treatment plans that were recommended by their doctors, and I just want to say one thing. I did not realize there were so many ways to tackle this issue, which is why I am even more excited to talk to our returning guest, Dr. Gagan, where we're going to explore different treatments and how to better live with vertigo. Ladies and gentlemen, welcome back to the Vital Sign podcast. Now, in the last episode, we spoke about vertigo. We created context as to what vertigo is and what vertigo is not. And returning this episode is none other than Dr. Gagan, who is going to help us explore and navigate the second part of the conversation, because now that we know what vertigo is, it's equally as important to know how to manage vertigo and if there are ways to prevent it. So, Dr. Gagan, thank you so much for joining us again.
Thank you. Thanks for having me.
This is going to be an exciting conversation. Like I said earlier, we've identified what vertigo is and the different types of vertigo. And then we've set context as to what vertigo is and what it is not.
Right.
One of the first things that I want to ask you, right, is can I have you reiterate to our listeners what vertigo actually feels like?
Okay. So back to what vertigo is.
Hmm.
Vertigo is defined by a hallucination of movement, which means either you are moving when you're actually not moving, so you feel you're moving around the room, Or you're sitting in a room and the objects are moving around you. And the majority of the time, what you feel with vertigo is the sensation of things are spinning around you. So, in essence, things spinning when they're not supposed to be spinning. That's what it is.
So I want to go deeper into what you just said. For many people, and for me as well, I enjoy understanding things at a deeper level, right? So when we're talking about vertigo and how it feels, are you able to give sort of a more detailed explanation as to the correlation between our eyes or spine and everything else that has to do with this vertigo?
Certainly. So, we know that balance is basically this huge network
Yeah.
where there are multiple players. There's the brain, there's the spinal cord, the eyes, as well as the inner ear. So, for example, vertigo can be caused by any sort of mismatch when these systems network together. Let's take BPPV, for example. We spoke about BPPV in the last episode, benign paroxysmal positional vertigo. And that's a condition of vertigo that is peripheral. It comes from the inner ear. And to illustrate what happens, in a normal person, each of us have canals, which are bony canals filled with liquid
Okay.
in each of our inner ears.
I'm trying to visualize it.
We've got 3 in the right, 3 in the left, total
Okay.
of 6. And these canals are semicircular. So they're arranged in all sorts of positions. And within these canals, there's fluid that moves. So as you turn your head in this plane, one particular canal is activated on one side, and so is the other. And they sense that movement. And when you move your head, the fluid moves in a very smooth movement. There's no problem. But sometimes crystals can form in these canals. And for a variety of reasons, and commonly it's basically minor head trauma. You just knock your head somewhere. And these crystals,
Sorry, the minor hit trauma causes the crystals to form.
one of the causes. No, the crystals can form due to a variety of causes.
Okay,
But
okay.
especially when you get older, crystals will tend to form.
Okay.
Many of us have crystals in our ear. As long as they're staying in that right position, that's fine.
Okay.
So, for example, if you have a minor head trauma or for whatever reason that crystal goes out of its place and now it's sitting within the fluid. And when you turn your head, the fluid is no longer moving in a smooth manner because of that crystal that's in it. So, that turbulent movement of the crystal in the fluid causes a completely different message to be sent to the brain. The message that's sent to the brain is as if we are moving. And because the brain takes in that input, that's when the sensation of vertigo comes along. And basically, to treat this problem, you just got to get the crystal back to the end of the semicircular canal, because at the end of the semicircular canal, there is a gel-like substance.
Okay.
And if the crystal goes and sits back in that gel-like substance, it gets stuck there. And to get it stuck there, to get it going back to the gel-like substance, is just a few maneuvers that we need to do. Generally, these maneuvers are accompanied with some sort of medication for the patient, and that helps the patient recover for this particular instance of BPPV.
And what maneuvers, as I'm visualizing it, is specific movements?
Specific movements in relation to your semicircular canals. So the crystals can form in any of these semicircular canals. Once we've diagnosed which semicircular canal is involved, and then we will need to rotate the patient in the axis of that particular semicircular canal to get the crystal back into the gel.
And the medication supports.
So the medication that we give for BPPV in particular, the medication that we give is this medication called beta-histine. That improves the circulation and blood flow to the inner ear. Now, whenever there's an injury to your vestibular system, automatically a compensation mechanism occurs. So when the compensation mechanism occurs, a lot more activity is required. And when you have a medication that increases the blood supply to your inner ear, that's going to hasten your recovery period, definitely.
Something that we reiterated quite a bit in the first episode, right, is when you feel unsure, go and see a doctor.
Definitely, yes.
I think it's become a mantra at this point.
Yep.
But I think for some people, it's difficult for them to understand what it is that they're feeling, whether it's double vision or whether it's a sort of weakness or whether it's muscle soreness for some reason. When do you need to seek help?
Okay, that's a very good question, because a lot of people get dizzy, a lot of people have a sensation of imbalance, and many of them actually may have vertigo. So I would like to just highlight certain red flags that you need to consider, that you need to see a doctor for. Number one, if you're having vertigo for the first time, that is something that definitely warrants a doctor's visit. If you've been having vertigo for some time, but now this particular attack is more intense, more severe, more prolonged, then you need to see a doctor immediately. If you're having vertigo spells which is associated with hearing loss, if you're going deaf in 1 year and then you're feeling the whole world spinning around you, that's an emergency. You need to see a doctor as well. And then there are symptoms which may suggest a more central cause. So that's the most serious one. We don't want to miss that.
Right.
So if you have vertigo associated with muscle weakness, if you're not able to speak properly, you're having slurred speech, part of your face, you're not able to smile, if you're having a severe throbbing headache, those are all very serious red flags that you need to see a doctor early.
So there are many red flags that you can be aware of that's going to allow you to decide then to go see a doctor.
Yes, that's true.
And it sounds like it's a long list.
It is.
It's
yes.
actually a lot. And a lot of the things on this list is not something that, any Tom, Dick, and Harry can just say, oh, you know what, something's wrong. It's one of those things where it's something that has to happen to you in a long enough period of time for you to start realizing, you know what, something's not right.
True. But when you have any, like for example, if you don't have vertigo and you're not able to raise your right hand, you would definitely see a doctor anyway. So I think the red flags are really, really important symptoms. But the ones which are not so important are things like headache. I say pening kepala, I got headache.
Yeah,
But
when you wake up from a nap and then you have a pounding headache.
Yeah, so I think it's important for the listeners to take home those things. If you're having vertigo and you're having a headache, if you're having, a very intense episode of vertigo, if you're having it for the first time, those are very important things to pay attention to.
Okay, so let's say now I feel weird and I go see a doctor, right? And I tell the doctor, I'm feeling dizzy. This is what I'm feeling exactly. And then the doctor tells me, this is vertigo. What are my next steps? What can I expect after that?
So once they've established a symptom of vertigo, the next step is, of course, to get the diagnosis. Now, the diagnosis a lot of the time depends on proper history taking and a proper physical examination, as well as other investigations that we need to do. But it's very difficult to take a history from a patient who sees you rotating around the room. It's it's not able to talk to you. So generally, one of the first things we do when a patient comes in with vertigo is actually to alleviate the symptoms.
Okay.
What a lot of doctors do to alleviate the symptoms is to give a vestibular suppressant. So just like we spoke earlier, we've got balance centers in our ears on both sides. So when one balance center is not working, what the suppressant is going to do, and an example of a suppressant would be something like diphenhydramine or chlorperazine. What they do is they suppress the other balance system. So now both balance systems are not giving you proper input. And automatically the brain now says, look, more or less the messages are the same. And the symptoms of vertigo sort of abate.
So it's like an equalizer.
It equalizes everything.
Okay.
But what it does at the same time, or what it does not do at the same time, is it does not tell you what the cause of the vertigo is.
Right.
What it has done is just taken away the problem. It hasn't really, you haven't really found the diagnosis.
I
So
see.
that's where a lot of GPs and a lot of health practitioners, what they do is once the patient's symptoms are gone, they then tend to take the thing a bit more lightly, because the patient says, doctor, I'm no longer feeling dizzy, I'm feeling okay, and you can carry on and go back home. So that's one of the things that is a common misconception, and sometimes you see it in health practitioners as well, where the moment the patient has no symptoms, and then you feel like, oh, there's nothing else for me to do, and then the patient gets sent home. And we've had cases where patients are so dependent and reliant that when they get their episodes of vertigo, they don't need to go and see their GP anymore. They've got the same medication from before. They just walk into a pharmacy and try to get that medication, and they get these vestibular suppressants, and they're taking it for weeks on end. So I had a patient who came in and she was prescribed a vestibular suppressant for 3 days, and she continued taking it for a total of 2.5-3 weeks. and she came in one day to the hospital in a full-blown oculogyric crisis.
What is that?
And an oculogyric crisis, for those who don't know, is basically your whole body goes into a full spasm and your neck is locked and your eyes are rolled back into your head and you can't talk.
Yeah.
That was disastrous for her family. So yeah, she was just living with vertigo, and every time she just took the medication. So it's very important to note that there are different types of medication to deal with the symptoms of vertigo. Vestibular suppressants are not to be used for long term.
So what she came in with, I can't, for the life of me, I can't repeat what.
Okay,
what the name
let's
is
not
called.
get too worked up about that. Yeah.
What she came in with, the whole full body spasm, that was caused by prolonged use
Of a vestibular
of
suppressant.
vestibular
It's
suppressant.
one of the known side effects of a vestibular suppressant,
Okay.
especially if you take it for long term. So
Okay.
we never advise patients taking vestibular suppressants for long periods of time. It's just in that acute phase, you take it for 1 to 3 days, and then let's find out what the actual cause is. So that's one of the classes of the medications we use, vestibular suppressants. Most of the time, in an acute setting of vertigo, if you want to take a proper history, you want to be able to assess the patient, you would generally give them a vestibular suppressant, because once the patient's vertigo is gone, only then will be able to tell you about their problem. It's very
Yeah,
difficult.
that's what I'm imagining as well. Because as we started this segment, I think you were saying that someone could come in with vertigo and everything is spinning around them, that they don't have the conscious mind to
talk to you. They
to
can't even
talk-
see you. Sometimes
Yeah.
they're looking at you and their eyes are going right to left, right to left. They're having
Yeah.
nystagmus, which basically means a movement of your eyes, which is
Yeah.
involuntary. So they really can't see what's going on. And
Yeah.
it's very distressing for them. So if you don't suppress the vestibular system and get them to start feeling slightly normal, you can't move on to the next steps of investigating to find out what the cause of vertigo is.
So what's a disconnect for me is you also mentioned there would be some cases where someone would come in with vertigo, and then they would be given vestibular suppressants.
Yep.
And then because they feel better, they're sent home.
Yes, correct.
Is there? So this is just me talking about the entire diagnosis process, right? Would doctors actually contextualize the process for the patient and tell them, okay, so it's going to be difficult to diagnose you right now. What I'm going to do is give you the suppressant, so that after that, even after you feel better, we're still going to find what the root cause is.
Yeah. So just like when you buy a car,
Mm.
the kind of salesman you meet has a huge influence on the type of car you buy.
Right.
Some salesmen will go through every single detail, and some salesmen don't.
Mm.
Now, by and large, a vast majority of doctors will say exactly what you said. Look,
Mm.
we were going to sort out this acute episode, this acute symptom, but we don't know the diagnosis.
Mm.
We need to do further investigations. We need to do further tests.
Mhm.
But some patients are too busy with their daily life. I think
Yeah.
they've got to make money. The cost of diesel has gone up. Everything is gone. So they've got no time. They just want their vertigo sorted so they can get back to work.
Mhm.
And so there may be an element where the doctor may advise the patient, look, we've sorted out this acute symptom. We need to find a diagnosis. Come back and see me in 2 days, or take this letter and go and see an ENT doctor, or go to the emergency department. But the moment the patient walks out the clinic, he's got no more vertigo. So he's like, I'm going back. I know this medication works now. It's a magic wonder drug. And so he's going to go to the pharmacy and buy it, and that's it. So he doesn't need to go back to the doctor anymore. Now he's his own doctor.
Yeah.
And so that's the problem. So a lot of patients actually walk away thinking that this is the medication to treat this symptom, and they just live with vertigo without actually getting to the diagnosis.
Okay.
Yeah.
Okay, so we know that vestibular suppressants exist. Are there any other drugs that doctors give to help with vertigo?
Yes, main classes of drugs, again, like I just want to get back to it. There are suppressants,
Mm.
and then there are compensators,
Mm.
right? So suppressants are things like cinazarine, diphenhydramine, fulcraprazine. And when you have compensators, which the most common drug we use is beta-histine.
Mhm.
So that's a completely different class of drug. A compensator, as the word says, it helps you to compensate with the problem. So we do know that whenever you have a peripheral vertigo, or whenever you have an insult to your balance system, your vestibular system, your body automatically starts compensating.
Mhm.
Now, the mechanism of compensation is way too complex to sort of frame in this segment. But basically, what it does is it uses minor cues from all other structures
Right.
of this whole network, and it helps basically to form these habituation techniques and exercises for your body to regain balance. So the compensators work by increasing blood flow to the inner ear. What we do know is the inner ear is supplied by terminal networks of blood supply. So basically, the blood vessel that goes to your inner ear that's the last destination. So when you have a terminal artery going there, blood flow is definitely going to be compromised, especially as you have multiple medical conditions. And a compensator will help to increase the blood flow to these areas. And we all know when there's increased blood flow, there's increased perfusion, there's of course going to be much better function of that organ. So compensators are generally used for patients with peripheral vertigo, and that is part of the compensation mechanism and more part of recovery. Whereas the suppressants are mainly used just for a short duration, just to get your symptoms sorted out. And that's the main essence, and that's the main classes of the drugs that we deal with.
So that's a lot of information.
Okay.
It's a lot of information, and this is why, the thing that we always go back to is go to a doctor, go check yourself out. If you feel unsure, if you feel like, even if you feel dizzy at any point, just go see a doctor. You're gonna have a much better outcome than trying to figure it out yourself. So there's something called the 3Ds.
Oh, yes. The 3Ds is what, when I teach my students in the university, I always tell them, when it comes to vertigo, you need to get the 3Ds. Right? So everyone talks about vertigo. The first D is your diagnosis. What is your diagnosis? What is the cause of the vertigo? Once you know what the cause of the vertigo is, then you can choose whether, first of all, the patient needs medication or the patient needs anything else, further investigation. And when it comes to medication, you got to choose the right drug. We are not proponents of using suppressants long term. We are proponents of using compensators generally if it's a peripheral cause. And when you choose the right drug, then the next D, well, it's 2Ds actually, is the dose and the duration. So you must choose the right drug with the right dose, with the right duration. And even in that situations, there are patients who, again, once they start feeling better, they stop taking the medication, and then you get failure of treatment. And the patient says, oh, the medication doesn't work. But it was actually the patient who did not take the medication as prescribed, or even the dose as prescribed. Take 2 tablets. The patient is taking 1 tablet every other day. So these things are very important. So the 3Ds are basically getting your right diagnosis, make sure you got the right drug, and with the right drug, make sure you're taking the right dose for the required duration.
So to recap, the 3Ds are diagnose, drug, and dose and duration. Is duration important?
Well, that's a good question. Sometimes I see my patient 2 weeks after I've started them on a medication, and they say, Doctor, I'm feeling well. Do I need to take the medication? So I always explain to my patients, part of the treatment, the main idea of the treatment, first of all, is to restore balance, especially in peripheral causes. Okay, once now we've established a diagnosis, say for particular, this patient has got BPPV. And part of the treatment for me is I will always give them a compensator, which is beta-histine. And I always start them for a minimum duration of 6 weeks. And some patients go up to 12 weeks. Now, the idea and the aim of this is so compensation can happen and the medication is helping. So patients who stop medication at 2 weeks or 3 weeks, I wouldn't say that they're definitely going to have treatment failure, but they are a higher likelihood of having some amount of treatment failure because they're not complying with the duration that we need to restore balance. We all know that physiologic restoration of balance can take anywhere from 3 weeks to 6 weeks, and sometimes even longer if you've got more comorbids and more medical problems. So in terms of duration, for me, I'll always tell my patient, take it for 6 weeks. Be prepared, you might even be taking it for longer, up to 12 weeks. That's important.
This reminds me of, and this is something that is going to be more relatable to people, especially if you've never had vertigo before. When you go in for like a fever and then you put on antibiotics, you are prescribed a certain amount of time on that antibiotic, and you may feel better before you finish the antibiotic course, but you are advised to finish it.
Absolutely.
And there's a reason why, because there's things that are happening within your body that the antibiotic is supporting, that is taking place even after you felt better.
Yes, absolutely. So just because you're feeling better after taking an antibiotic, it doesn't mean that there's no more bacteria within you.
Right.
It just means that your body is now beginning to compensate and beginning to fight with the help of the antibiotics. And if you stop it too soon, before your body has gotten on top of the condition, the antibiotics can sort of win the battle again.
Right.
And that's the same with with peripheral vertigo, especially BPPV. Stop the medication too early. Compensation was happening, but now you stopped it, and
Yeah.
that doesn't go along anymore. And
Yeah.
then you say, oh, it's the wrong diagnosis, or the doctor wasn't good, or whatever it may be. That's what happens.
Thanks, Dr. Gagan. We're going to take a short break. And right after the break, we're going to discuss strategies to cope with vertigo long term. And we're back in our seats. But in this particular segment, we want to talk about how you can stay on your feet. So, with vertigo, obviously, we've identified that some of the risks or some of the most significant risks of vertigo is falling.
Yep.
And this is caused by the world around you moving even though it's not, and you're not knowing where to step, and your entire world is shaken up, so the risk of falling is significantly increased. But how or what do we have to do then to help reduce this risk of falling?
That's a good question. I think a lot of people have this conception that, oh, if they have vertigo, they see a doctor, and then it's going to be treated, and they'll be back to normal the next day. But just like what I spoke about before, there is a compensation process that takes place. And during this compensation process, you're not going to be completely back to normal. So there are going to be chances where you feel a little bit off balance. You may have a very transient episode of something spinning for a second. And that's all very normal as part of the compensation mechanism. So with my patients, I always tell them, to reduce the risk of falling, how you're going to cope with vertigo. There are a few things you need to do. If you're having a very sudden bout, or if you feel unsteady for the day, just lie still in a quiet, dark room. When you're sleeping, especially with BPPV, I always tell my patients to sleep with at least 2 pillows. When you're walking around, moving around the house, please ensure there's adequate lighting. We can't have shadows around playing with light, because that's when you miss your step. If you need help to walk, it's very good to have a walking stick. Yeah, a walking stick is very helpful. If you're getting up from a seating position, or if you're coming out of bed, again, do it slowly.
That's the one I hear the most.
Very slow.
Don't
So you
get
gotta
up
be
too
slow.
quickly.
Yeah, correct. And then in terms of what you shouldn't do, yeah, you shouldn't be bending over. And as we know, a lot of people who have vertigo tend to be women, and they are in the kitchen cooking for us, of course. And we are happily playing with our television or iPhone, and they are downstairs looking under the cabinet or looking above. And when these sudden movements of lifting your head and bending down, that can trigger a vertigo attack as well. So we tell our patients, look, once in a while, let your husband go and do the cooking, and you sit down and watch TV. Let him know what it feels like.
He's gonna order pizza.
Most likely, that's what
He's not
he'll do.
gonna- So this bending over thing is interesting, because it's not. I mean, it's more so for vertigo patients.
Yep.
Right. But I think it's also what's the word for it? Ill-advised to bend over to pick up stuff because of your back or your spine.
Yep.
So I think it's good practice anyway, even if you never had vertigo.
True. You shouldn't be simply bending around.
Yeah.
Then sometimes, of course, like we said, it's a whole network. So if you have vertigo that is caused because of the ear, but you also have spinal problems, and then that may precipitate a whole another attack of imbalance because you've bent over. So you've got to be very careful with moving, especially as we get older. It's very important. Also, it's very important whenever you're walking around as well. It's very important to make sure you don't have any slippery surfaces there, and that
Right.
doesn't necessarily apply to people who have vertigo. Even you and me, there are many cases of young healthy people running into the bathroom and falling down and getting fractured.
Yeah.
So it's important to make sure that you take care of your house, and then your house will take care of you in that
Yeah.
way.
So after diagnosis, right? After seeing the doctor, after the doctor telling you the do's and don'ts, and then giving you the medication and how long you're supposed to take it for a lot of people who have a 9 to 5 job, or they have kids, 3, 4 kids, or even one kid sometimes,
Yeah.
it's difficult for them to follow this system to the point where they get to reap the benefits of the medication that was prescribed to them, and hopefully make them feel better. As a doctor who has had patients like this before, how would you recommend them maintain this system for themselves?
That's a good question. Everyone's so busy with their lives, and what I do from the outset in the clinic visit, I always explain to the patients, first of all, what your diagnosis is, your duration, what the medications need to be taken, and a lot of the times patients tend to forget. So patients who I feel are very busy, and most of them are, I generally recommend them to use an app. It's called the Vertigo Coach app. It's available for free on the smartphone. And that's a good app because what it does is it tells you articles, recent articles published with relation to vertigo. It has videos on the exercises, so you can actually look at the
Oh, that's
videos on
cool.
the app.
Okay.
Yep. And not only that, it has reminders for your medication. It has reminders for your exercise. So with the reminders, but you have to turn your notifications on.
Yeah, of course.
And with the reminders, then most of the patients tend to be more compliant, and at least that helps.
Okay, so I want to take it to the next segment. In the first episode, I said the same thing. This is arguably my favorite segment. This is
Alright.
when I bring up myths. They can be statements. Some of them are maybe short questions.
Okay.
And your job, doctor, is to debunk them. Is let
Okay.
me know if they're true or they're false.
Sure, let's go.
After I say the myth, I'm going to give you space to elaborate if there's any elaboration needed.
Okay.
Cool. Awesome. So the first myth is that there are visual exercises one can do to overcome vertigo.
That's a true statement.
Mm.
There are visual exercises. For example, I'll give you one. Just sit upright and put your thumb right in front of your face.
Fall
And-
out.
Yep, thumb out. Look at your nail of your thumb. And now you rotate your head to the right, but keep your eye at the thumb. And now you rotate your head to the left, keeping your eye at the thumb. And you just practice doing that right and left.
Wait, hold on. The fact that I did this instead of this means I got a brain problem, bro. You said rotate, I went like this. That's a brain problem. That's a brain problem. I diagnose you
That's
with
not
stupid...
vertigo.
Rotate your head. Oh my god. Ah. Okay.
Okay, maybe I'll use the word turn your head to the right.
Yeah.
Turn your head. Okay.
Anyways, myth number 2. Dietary modifications can help with alleviating vertigo symptoms.
That's true, but it doesn't apply to all causes of vertigo. We spoke about Meniere's disease in the last episode. So that's a condition where there's too much of pressure built in your inner ear. And that's been associated with a high salt intake. So for certain conditions like Meniere's disease, we advise patients to reduce their salt intake. That helps. For certain people who get dizzy spells, not necessarily vertigo, but if they get dizzy spells because of dehydration, and then we tell those patients, look, take more water. We also know patients with extremely high sugar levels can also get dizzy spells. So we tell patients who are diabetic to watch your sugar intake, to keep an eye on your sugar. So dietary advice does help for certain conditions.
Cool. Myth number 3, vertigo can kill you.
Vertigo in itself, probably not.
Yeah.
But the consequence of vertigo can
Yeah.
kill you. So you can have someone who's 85 years old, who's very osteoporotic, and then because of vertigo, she has a fall, and then you have a femur fracture, or you have another fracture somewhere in the long bones, and you're bedridden. You're in the hospital for weeks, you get a subsequent lung infection, a chest infection, and you eventually succumb because of all sorts of other problems. But it all started with the
With the
fracture,
vertigo.
and the fracture was because of the vertigo. So yes,
So
vertigo
th-
can
yeah,
kill.
it sounds like it's a language issue.
Yeah,
Because
that's true.
it's not vertigo itself that kills you.
Exactly.
It's what happens after you get vertigo. the
Exactly. Imagine
consequences
you're
of it.
driving on the Penang Bridge,
Yeah.
and suddenly now the bridge looks like it's going 360,
Yes.
and you drive yourself off the Penang Bridge,
Yeah,
and then they
you're
say,
scared.
"Oh, he was suicidal," but actually he was just having bad vertigo,
Yeah.
and because of the vertigo, his car went off the bridge and he's
Yeah.
dead. So that these things happen. It can cause death, but not directly as a result of vertigo. It's a consequence of what happens
Yeah.
after.
Okay. Myth number 4, vestibular suppressants can be taken for long term.
No. So again, when it comes to vestibular suppressants, I would exercise patients as well as practitioners. Be very careful about giving patients vestibular suppressions for prolonged periods of time. The risks associated with it can be very, very serious.
Like the full body
like the
spasm.
full body spasm. It's called an oculogyric crisis.
Mhm.
So I would never recommend vestibular suppressants as part of a regular armamentarium of medication for the patient. No.
Okay. And the last one, myth number 5, is supplements can help.
Well, supplements, there's no direct evidence. There have been many studies that link vitamin D, ginkgo, vitamin C, calcium with relation to vertigo, but there's no universal accepted supplement that says, look,
Right.
this helps with vertigo. A lot of patients tend to feel better. They have a general sense of well-being when they take certain supplements, and I'm not here to stop them. As long as it's approved, then they're happy to take it. And sometimes there may be a psychogenic feeling as well. They feel like, look, I've taken the medication now, I don't have vertigo at all. And then some patients become religious with it. They say, oh, doctor, I must have my ginkgo, or I must have my vitamin C. And without my vitamin C, I feel helpless. I'm not in a place to stop someone from taking it, but we do not have any direct evidence to conclusively say supplementation reduces vertigo.
Woo! This episode, I think, uncovered a lot of things, mainly about vertigo.
Yep.
And for our listeners or our viewers, if you guys have watched this far, if you listened this far, I'm super sure that you now understand vertigo better. And because you understand vertigo better, I think it's also important for me to reiterate that dizziness isn't always vertigo, and vertigo isn't a one-size-fits-all diagnosis.
Yep.
And a lack of diagnosis may spell a more complicated future for you. So the moment you feel like something's wrong, or if you've never felt vertigo before, having vertigo feels like something completely new to you. You're going to feel like your world is spinning. You can't walk. If you're driving, you're going to feel like the car is moving, but you feel like it's moving in a way that's unnatural to you.
Yep, absolutely.
And then when these things happen, just stop what you're doing, right? That's the advice
First
is,
thing, yep, stop.
first thing to do is stop what you're doing. And remember the do's and don'ts that Dr. Gagan was talking about. Do the ones on the do list, obviously, and then find the time to go see a doctor.
Absolutely.
Find a time to go and tell them exactly how you're feeling. That it may be dizziness, but try your best to tell them exactly how you're feeling so they can help you identify what it is that you're going through.
Yep, completely. I agree. I think the first episode of Vertigo, you need to see a doctor. We've spoken about the red flags when you need to see a doctor. You just need to follow that advice.
Yeah. So before we close this out, Dr. Gagan, are there any parting words that you want to give our audience that you think you haven't said before?
Yeah, I think just to sum up everything, if you have vertigo, vertigo is not the diagnosis, like you said. Your job as a patient who is suffering from vertigo or even a dizzy spell, the first thing you want to know is, what's my dizzy spell? Is my dizzy spell presyncope, disequilibrium, or vertigo?
Yep.
And then if it is vertigo, now what's the cause of the vertigo? As a patient, you have a right to know. And it's your duty as well as the doctor's duty to try to find out what is the cause. Because you can't just be telling people I've got a friend who said to me, oh, my grandmother's been living with vertigo for 20 years. I'm like, what's the cause of the vertigo? Nobody really knows. You need to find out what it is, because otherwise you have very, very tragic and fatal consequences, and you don't want something like that to happen to your loved one, to yourself. And I think in that sense, anybody who has a dizzy spell, who suddenly has a change of, anything, like that guy who was playing golf, he just stopped playing golf because he has dizzy spell. So try to pick and be aware of things around you. And if you know anyone who is having a dizzy spell, or can come and tell you the world is spinning, get them to seek medical help. It's going to change their life, definitely.
A life quote that I quite enjoy, that I think matches well what we're talking about today, is the first step to solving a problem is to identify the problem. And that's the first responsibility that you have as the person who's going through this.
Correct.
Or if you're taking care of a loved one, the first step is to identify the problem so that you can then solve the problem.
Yeah, absolutely.
Thank you so much, Dr. Gagan. This is the end of the episode. I've enjoyed this conversation so much. I think we went through a lot. I have learned a lot about vertigo just based on this episode. I hope our listeners have gotten just as much value as I have. And I hope we meet again soon.
Certainly. Thank you so much for having me, Afiq. I'll see you around soon.
Awesome.
Thank you.
Thanks. And that pretty much closes out our conversation on vertigo. Now, if you take anything away from this episode, it's that you need to listen to your body. Your body's trying to tell you something, especially when it's trying to tell you to go see a doctor. Now, in the next series, we're going to be unearthing a condition that's long believed to be an affliction of rich, portly old men. It's on the rise, and it's affecting the young. All that and more in the next series. I've been your host, Afiq Kamarudin, and this has been the Vital Sign Podcast. This podcast is a production of Renegade Radio. It was produced by senior producer Kelvin Tay and producer Ragini Rafi. Written by Alisa Pong Lee Ann and Arnalden Brian Henry. Edited by Dixon Chia. And once again, I've been your host, Afik Kamarudin. Catch you next time on the Vital Sign Podcast.